Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Haley Peffer, Digital Managing Editor at thehorse.com. As horses age, their healthcare needs and associated costs often increase, making proactive management especially important. Having your veterinarian perform regular examinations, dental evaluations, and monitoring for common senior conditions can help you catch problems early and potentially reduce long-term expenses. Senior horses might also require specialized feeds, medications, or additional supportive care, which can increase monthly costs. Developing a preventive care plan and budgeting for age-related health needs can help owners support their horses' comfort and longevity. This event is sponsored by Care Credit. To answer your questions, we are joined by expert panelists Dr. Jonathan Yardley from The Ohio State University and Dr. Alex Bianco from the University of Minnesota. Welcome to both of you.
Thank you.
Thanks, happy to be here.
Dr. Yardley, can you tell us a little bit about your background to start off?
Yeah, sure. I'll truncate it here a little. I'm originally from Massachusetts. I did my undergrad. I did vet school at Tufts University. I graduated a long time ago. I did an internship in Ocala, Florida. Worked on some racehorses. And I got drugged to Ohio by my wife, and I did mixed animal for 6 years. And now I've been doing equine only for the past 12 years at Ohio State. And basically what I do every day is I take fourth-year students and some house officers with me, interns and residents, and we go out into the field and we see cases every day.
Awesome, thank you. And Dr. Bianco, can you tell us a little bit about your background?
Yeah, so I grew up in Minneapolis, Minnesota, so I'm a Minnesota lifer. I went to vet school at University of Minnesota and then did my internship in Kansas State, at Kansas State, which my family thought was moving to the South, which is funny if you're from Minnesota. But and then I went to Purdue University for my large animal internal medicine residency, which was great. I did a little bit of ambulatory work at Purdue for another year, waiting for my husband to finish school, and then I brought him back to Minnesota to be when I started here as faculty in large animal internal medicine about 10 years ago now. What I do today is I mostly work at our large animal and equine hospitals, so doing clinical work, seeing internal medicine cases, and also do a lot of teaching of veterinary students.
All right, thank you. Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions that were submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. So, Dr. Yardley, our first question is for you tonight. It's from Jen in New Jersey, who wants to know when a horse is considered to be a senior.
Yeah, it's a great question, Jen. So I think most people go with between 18 and 20 years of age, depending on who you ask. But the National Research Council for Horse Nutrition usually talks about between 18 and 20. In my own practice, I start thinking about older horses around the age of 15, so like middle age, kind of senior. And is now, like we'll talk about tonight, like with how much nutrition has changed and management of these horses, like 15 is like half their life. Like most of these horses are now living into their 30s and competing into their late 20s. So that's kind of what we think. That's how I kind of classify them in my own practice.
Dr. Bianco, our next question is for you from Tasman in England, who asked what the most common expenses associated with owning senior horses are.
Yeah, that's a good question. I think part of it depends on what you're doing with your senior horse. Like Dr. Yardley just mentioned, a lot of our senior horses are continuing to work well into seniorhood. So it may be that costs are the same as when they were younger. And it may be also that some costs, if you aren't working as much or if you're not exercising or competing, that some costs are swapped out with newer costs for senior horses. So it can be that they may require some more regular vet care, more dental care, more regular diet changes or evaluation of diet. So it really kind of depends on the senior and what you're asking of them. If we're talking super senior, are, 25, 30-year-old horses versus our, 18-year-old horses that may be pretty much doing the same thing they did as a non-senior.
Dr. Yardley, Deborah in Massachusetts wants to know how owners can manage the rising cost of horse care, especially with special needs senior horses.
Yes, I'm not 100% certain by special needs, but we'll just say if we're talking about horses with like Cushing's disease or with dental issues, I think most of those things, unfortunately, is just kind of staying on top of their healthcare management system. So for older horses, if I'm going out to do dental checks and floating their teeth and looking for fractures and senile teeth in these horses, I think doing it more routinely, although that doesn't save you money per se, it does prevent a large bill from something that has gone kind of awry along the way. So really preventative healthcare is kind of some of the best things that we can do to kind of prevent these kind of unexpected, really large bills that will show up for these horses.
Dr. Bianco, Beth in Pennsylvania asked if it's possible to get insurance for the first time on a senior horse.
So insurance is definitely a topic that has some pros and cons and is a bit different in horses than people are familiar with, small animal insurance. And so I'm not an expert on insurance, and there's lots of different companies, but in general, in my experience, it is difficult. It can be difficult to get insurance on older horses, senior horses. And some insurance companies may have a maximum age in which you can insure the horse. Also, there's probably, there's increased costs with insuring a senior horse. So I think if you're getting thinking about insurance for the first time, and depending on the age of your horse, it may be more cost effective to have a savings plan, having some savings set aside that are dedicated towards potential emergency veterinary costs that then also you still have if you don't need them, and you can use towards other things. So that would be my recommendation, I think, with a senior, is think more about having a savings account or a designated, money pile for needs rather than insurance in a senior. But there may be horses that have different situations. I don't know, Dr. Yardley, you want to jump in?
Yeah, no, so I usually recommend to clients, there are some supplements, which I don't always recommend, but there are some supplements on the market that do have some colic insurance plans with them. But you do want to read the fine print, because there can be some exclusions on them. And then some of them you have to have very strong involvement with your veterinarian to check all the boxes. And if you don't check the boxes, like any insurance company, they'll deny that insurance. So just be very careful. I know the sponsor of this talk is Care Credit, and Care Credit is you can leverage your Care Credit because it can be interest free. So like Dr. Bianco said, like if you have a savings account set aside that you're making some interest in, you can go with the Care Credit and have zero interest for a certain amount of payments. Just so that could be another option. And something that I talk about with my own family, well, I guess our dog, I don't own a horse anymore, but with our dogs, my wife and I have like a set amount of money that we're willing to spend on the dog. And I think that's it's easier to have that conversation, like when you're both not in the moment of like a tragic occurrence. And that way you're not like financing your house to do colic surgery, which I've seen people do. And I'm not their money manager, but I don't know if that was a good investment. But for them, it was. So I think having those conversations ahead of time, kind of setting a limit of like what you're willing to spend, is really important to have.
Absolutely. Dr. Yardley, Angela in Florida wants to know how often a senior horse should have a dental exam, and what are the benefits of having this done regularly?
Yeah, so I usually recommend for the senior horse at least twice a year, especially if they're starting to have more expired teeth. So their teeth really, a horse's mouth likes to, in humans too, so the teeth like to hit each other. And as these horses get older, their teeth aren't erupting as much, and the teeth kind of get out of balance, like big time get out of balance. And by getting out of balance, it causes more damage to the other teeth that are left in the mouth. So we have to preserve as much as possible tooth that is working. So by going in there twice a year, a lot of these horses were able to kind of preserve what teeth they have, which sounds like the opposite because, we're kind of filing down some certain areas, but we're actually preventing it from damaging the tooth above or below it. So twice a year is usually what we recommend for these kind of older guys. And I think a lot of people traditionally, like growing up, were like, oh, old horses don't need dentals, blah, blah, blah. It's like, no, they actually need it the most out of everyone. And I think having, your veterinarian out to do the floating, to do a really good dental exam. And sometimes those dental exams are going to include some radiographs because their teeth can get loose, they can have fractures, they can have some root abscesses. So just doing a really good exam of the mouth plus or minus radiographs every once in a while, plus having your veterinarian out to float away some of the sharp points, I think is super important. And by having a veterinarian out there, their veterinarians know how much to take of the tooth, and we really need to preserve the teeth in these horses. I've seen some other folks out there like really float these horses very aggressively where they can't chew after having a dental, and that's not appropriate. They need to be able to chew.
Dr. Bianco, Rebecca in Nevada asks what expenses are associated with end-of-life care and euthanasia.
I think this is a great question because I think it's something that people often don't think about until they have to think about it. And I think that's true. Like when we're talking about expenses and insurance, that like end of life care starts hopefully a long time before we actually hit the end of life. I think it's hospice care and discussion of end of life is really something that we need to do more of with our horses, especially one of the biggest things that people don't think enough about is disposal of the body afterwards. Depending on where you are, here in my area in Minnesota, most of my clients are at big boarding barns and they're not going to be burying horses on the property. That's not an option. Renderers to take the body have also become, again, here it's become a lot harder to find renderers that will pick up horse bodies. And so there might be other limitations. Our group here has done some research on compost of just carcasses, and that has been something that's a really great environmentally friendly and low cost option, but the legality of it varies state to state. And commercially composting, having a person who that's their service or business is hard to find. So I think that can often be the biggest cost and challenge is, wanting to be respectful and, put your loved horse down to rest somewhere. And the what you do with the body becomes a big hurdle, literally a big hurdle. And so I think discussing with your veterinarian or people in your community, what the options are, and figuring that out ahead of time so you have a plan in place. Also, being able to control when you say goodbye, I think is really important so that you have a plan with your veterinarian where it's not an emergency, because having your vet out in the middle of the night can be traumatic because it usually means it's something that you didn't expect. If something happens and like older horses that go down and can't get up or, have some type of injury where you're having to make that decision in the middle of the night, and call it out and have it be an emergency, that's always going to cost more. So talking to your vet when you have a senior horse, I love senior horses, but we do know the end is not as far away as it was when they were younger. So having those discussions and having a plan in place and kind of having those financial numbers as well, I think is a really good idea when you can. Obviously, there's still those situations you can't predict, but those are things that I think having those discussions with your vet early are really helpful.
Yeah, I usually, when I start seeing older horses in the fall, when I'm doing fall vaccines, I will start having a conversation with the client because, like Dr. Bianco said, like the horse that can't get up in the middle of winter it's pretty like tragic. So I always rather have the horse walk out into the field and lay down one last time with everyone present. I think much nicer than a horse that's frozen to the ground personally. So having those conversations and having your veterinarian just be honest with you. And my clients know that I'm pretty straight to the facts, so they'll come up to me and, usually with a tear in their eye, they're like, is it ready? Is it time yet? And I said, no, but a couple months and, before the ice comes, we need to do this. So yeah, and disposal is really hard. Usually, like, we have a couple people here in Central Ohio, we're lucky, but that's not necessarily true. And like the water management, like burying if you were, some places it's illegal to bury the horse on the farm just because of watershed areas, and then you actually probably don't want to bury your horse close to your well. So you have to be like pretty careful where you're putting these horses.
And on that topic of euthanasia, Dr. Yardley, Crystal in Texas wants to know if a veterinarian can legally and ethically euthanize a senior horse if the owner can no longer financially support them.
Yeah, it's a two-part question. I think I'll answer the first part. I think legally, the veterinarian, because it is property in that sense, unfortunately, the veterinarian is legally allowed to euthanize the horse. But I think the ethical issue is going to be the bigger one. So your veterinarian would need to be kind of comfortable with that. So for like me personally, I think I would struggle to put down like a happy, healthy old horse just because they couldn't be afforded anymore. And maybe I would try to seek out some other ways if, to reduce costs, or if they could maybe donate the horse to someone or go to a big field somewhere to kind of retire. So I think for ethically, everyone's going to have a different window of what their ethics are. But I would think it might be hard pressed unless the horse is like really sick. I think it might be hard to find a veterinarian willing to do that personally, but everyone's different.
I'll say one thing I would say is that if you have a horse that requires a lot of financial investment to keep them comfortable, you have older horses that, yes, maybe they're doing okay, but you have to spend a lot of money on keeping them sound or having like the diet to keep they have very little dented teeth left, and so you're spending a lot of money to keep them going. I think sometimes that's a different scenario for me. It depends on if that is something where it's going to be hard to find someone else to take that burden of care on. Then that without that level of care, that horse would not do well, like have a poor quality of life, would lose weight. Those things, I feel like I have an easier time ethically euthanizing them, because usually those people have spent a lot already getting them that far, and it's just there's something called caregiver burden that they talk a lot about in human medicine that we don't talk about very much in veterinary medicine, especially large animal. But I think that's also something to consider, as well as the well-being of the people that are taking care of really high needs animals, and considering that as well in some cases.
Dr. Bianco, Olivia in Ohio asks what owners can do to proactively manage senior horses and reduce long-term expenses.
I think the biggest thing is that we've touched on is that regular care. Don't stop. There's a study that shows that older horses are less likely to have regular veterinary care. I think because people, they're not maybe using them as much or performing anymore. But I think the opposite is really what's needed. Older horses likely need more regular veterinary care, and it will save money in the long run by catching things early, things that are more common in older horses, like dental diseases, their teeth expire, and PPID, we talk about that. So like if you catch those things early and you address them more regularly, that definitely saves in the long term. So I think that having that relationship established of regular wellness exams every 6 months is a great thing for older horses. Some people wait until there's a problem before they get help, and that's always going to be more expensive. If you have a horse that's already having trouble keeping weight on, or it's in poor body condition because it's really severe dental disease, that's a lot harder to fix than if you prevent it by having regular dental care proactively. So that's the biggest thing, is just having that regular preventative care. Even as horses get older, even if they're retired, they still need to be seen by a vet regularly.
Dr. Yardley, Alicia in Florida wants to know what unique housing requirements senior horses might have.
Yeah, so I can answer it from Florida and from the north. So in Florida, if your horse was to have PPID, it's gonna have heavier hair coat. It's going to probably sweat a lot more and be a little more uncomfortable in this high heat and humidity that is common in Florida. So having good ventilation for that horse and having a place where it can get in the shade and the cool is going to be super important for the horse in Florida. For the horse up here in the north, it's going to be having in the wintertime, having like a warm place for the horse to go. As these horses get skinnier, they have a harder time kind of maintaining, or if they're not eating as much, maintaining their warmth. So trying to keep these horses in a kind of dry environment that is out of the wind is going to be, I think, pretty important for these guys. And especially too in the cold, if the horse wants to lay down because they're arthritic, is having the stall be bedded really well so the horse can lay down and is not choosing to lay down outside in the cold.
Dr. Bianco, Diane in Arkansas asked how long a senior horse can live on MASH and if he can exercise when he can no longer have a solid food diet.
I'll answer that in two parts. Let's say we are really fortunate that we have access to so many great senior complete feeds now that has allowed our horses to live longer and longer. So a senior, there is no limit to how long they can live on MASH. I think as long as you are, again, having that regular veterinary assessment to make sure their body condition is appropriate and that they are able to maintain weight, or having a certain guidelines on how much they're getting and what body condition you're aiming for, what your goals are to maintain. It has to be, a complete diet, having a complete feed. So whether that's a senior feed or some combination of senior feed and some diet plan that you've worked out with your vet, but there's no real limit to how long they can be on a MASH as long as they're maintaining their body condition. And in terms of exercising, they can exercise when they can no longer have solid food. It's just about maintaining body condition and doing whatever that horse's, orthopedic concerns, if they have them, whatever that allows. I think it's really important to keep exercising senior horses to what level they can exercise. So we, again, just like older people, as we age and develop arthritis, being sedentary is not good for us. And so even older horses benefit from exercise. It doesn't have to be strenuous. It can be as simple as groundwork or carrot stretches, or those types of exercise also help with things like mobility and helping with arthritic pain. So I'd say that definitely keep exercising, but talk to your vet and know your horse about like what their limits are given what other health concerns they may have. And if they can't maintain their weight, with the diet they're on, with any kind of increased exercise, then adjusting that kind of to the horse's needs.
Dr. Yardley, Ophelia in British Columbia says she struggles to keep up with her horse's expenses. What can she do to care for them properly without depleting her savings?
Yeah, I think it's a tough question, as these questions this evening have come in. Like, clearly it is expensive to take care of these older horses. So for me, it would be, if I was having this conversation with Ophelia live, I'd kind of look at what her expenses would be and try to pick from there what are going to be like the most important to keep this horse happy and healthy. And I think the biggest things, like, everything is super important, but if your horse has PPID/Cushing's, like, being on medicine for that, unfortunately, it's not something I might cut from the budget. And if your horse has arthritis, being on an NSAID, an anti-inflammatory, again, super, I think, really important to keep these horses moving and kind of keeping them kind of healthy. So those would be the things. And then, where can you cut from the budget? Maybe for me, so I'm going to go like very scientific here, I might be cutting things that maybe aren't as efficacious. So if you're getting like massage therapy or some other sorts of kind of adjunct therapy, and those, add up over time, maybe those aren't the most efficacious ways to kind of spend on the horse, because I'd rather see you spend your money on treating the percent or treating for arthritis, and then you're spending the money on a good quality diet for the horse. So those are like the big three for me. And then kind of from there, if that is kind of gets you in the range of like a good place financially, then that's what I would do. And then you can do all the kind of add-ons after that. I don't know, Dr. Bianco, do you have any other suggestions for that?
I don't think so. I think that's so individual that everybody's budget is so different when it comes to horses that I think I agree that kind of sticking to like what are the going over with your vet, what the most important needs are and prioritizing, I think is really going to be the key there.
Dr. Bianco, Pam in South Carolina wants to know what types of supplements might be beneficial for senior horses and how she can choose one that is high quality.
I think this is kind of comes from our last question, in that supplements are the things that I would take the horse off of if I really are worried about finances. And I think supplements just like in humans, the whole nutraceutical and supplement industry is not regulated by the FDA. And so there's very little, some supplements maybe have done some research and many have done zero research. And so it's really hard to tell, what maybe has data to support it and what doesn't, because people can say whatever they want. And so I think it is good to be thinking about that. The only supplement that I recommend is omega-3 fatty acids, just because they can help with, or they have been shown to help with various conditions like equine asthma or other inflammatory conditions like osteoarthritis. Even that though, the data isn't solid when it comes to horses, but an omega-3 fatty acid is something that I know is not going to hurt. There are various ways to get that supplement in different forms. And that's really, other than that, there's not anything that I think a horse needs, as long as I think they have a complete feed, that their diet is really well managed, that the supplements are kind of extra. Many of them probably don't hurt, but whether they actually help is pretty debatable. You can add if you have things to add to that, Dr. Yarley, because this is a bit of a big topic.
Yeah, I mean, the only supplements I recommend are the ones that potentially would provide some sort of, if you're going to do a supplement, would provide some sort of insurance plan for your horse, because it's a backdoor way to get insurance at times if you read the materials correctly. But I think the omega-3s, the vitamin E is like a great supplement, but besides that, there's nothing I really recommend. And I think a lot of people are spending a lot of money on this. Like I call it like the TikTok health trends, and I see it in our students of like what's on TikTok. They're telling me about their 3,000 protein they're eating today, and I'm like, okay, great. But it's very, the whole industry is just built around marketing, unfortunately.
I think it's great though to bring up like vitamin E, and when I recommend omega-3s or vitamin E, it's because I've seen a horse for a specific condition, and I'm recommending it as part of their treatment plan. Like I diagnose a horse with asthma, I recommend an omega-3 fatty acid. Or when I'm looking at horses and I'm concerned about their vitamin E because they don't have great access to grass pasture, then I will recommend vitamin E supplement. So I think I agree that there's very few things that all horses blanketly need just because they're horses, and people will sell whatever they can convince you to buy.
And not every vitamin E is absorbed by the horse too. So talk to your veterinarian as to what the correct vitamin E source is.
Do either of you have any advice for people if their horse actually does need a supplement, how they can choose one that is truly backed by research?
I think for talk to your vet, obviously, but for vitamin E, I think a pure supplement. So there's supplements that are just vitamin E, and having the natural form of vitamin E is really important. So there are only a couple products that actually, have that as the ingredient. And then omega-3s, I prefer, like, there's omega-3 supplements that have some data behind them, or that are just pure omega-3, like ground flaxseed is one that I recommend, because you can buy it as just ground flaxseed and it's just that alone. But because a lot of horses won't eat like oils, so like flaxseed oil, that can be really expensive and not very palatable. So I think it is good to talk to your vet about what because vets are good at, what part of our job is to be able to evaluate the literature in a product and say like this has data behind it or not, and so they'll be a good resource.
Dr. Yardley, Melissa in our live audience has a 25-year-old Haflinger with arthritis in his hocks. She does not ride him, but she does do groundwork. She asked if walking over poles would be recommended as a good form of exercise, or if that could cause more issues for the arthritis in the hocks.
I would think doing that would be perfect. Keeping these horses, like we said earlier, keeping these horses moving is so important. And if he, needs to flex his hocks a little to go over a ground pole, I think that is perfect. Like, I don't think it's going to make the arthritis worse, especially a low impact exercise like that. And like we've said earlier today, like if you look at the literature in elderly humans, like when they stop moving is when bad things start to occur. So keeping these horses moving, even if they have arthritis, I think is very important. So keeping that Haflinger going is, yeah, I love Haflingers too. They're one of my favorite little pony breeds, but we usually don't see them we usually see them for laminitis, but yeah, they're great little horses. Yeah, keep exercising them.
And Dr. Yardley, Alyssa in California asks how EOTRH can affect a horse's health and how expensive it might be to manage the condition. And could you also just explain what EOTRH is for people who might not know?
Yeah, I'm not going to actually say the big word because I struggle pronouncing it, but basically it's the teeth are making too much cementum, like stuff that kind of holds them together, and being resorbed at the same time. So it's kind of like a kind of misbalance of the horse's mouth. It's usually always kind of their incisors. I think I'm going to answer this. This is a two-part question. How expensive to manage the pain? It depends on how painful the horse is. Some of these horses are very painful and they have tooth root abscesses that you can see in their gum line. And unfortunately, the only management for that is removing these teeth. So seeing a dentist or a surgeon that is comfortable removing the horse's incisors, I think is the way to go. And even here in Ohio, I think it's a pretty expensive thing. It's very time consuming. Most of the time when horses come in for that here at Ohio State, I think they're probably 4 or 5 hours for their procedure to remove all the incisors. So it does get expensive. When I make the diagnosis on the farm, when I'm taking x-rays of these older horses, for me, I had to balance it personally of like, does this horse like not eating as well? Does the horse seem super painful? Like, is this an expense? Like we were talking about expenses, like can the horse live with this condition? And can we manage kind of the pain that way? So instead of going to like removing all the horse's teeth. So I think that's kind of how I do it. I think everyone has a different kind of point of view of this disease. And I think if you think about like small animal veterinarians talk about dogs that have like broken teeth, and your lab might not be playing with the ball anymore, but you remove the broken teeth and the lab starts playing with the ball again. So we don't really know how much pain the horse is in until you remove the teeth. So I think that's kind of the hard part with this disease, is trying to kind of think about managing it that way. But if you do the surgery, it's not going to be cheap.
Dr. Bianco, Talia in Massachusetts says her horse was diagnosed with PPID at 16. Does he need to retire? How can she manage a horse with PPID and account for the expenses associated with this?
Yeah, so 16 is pretty young, so hopefully that was an early diagnosis, which is a key to good, successful management for PPID. When we first recognized PPID, or equine Cushing's as we called it back then, we weren't recognizing it and diagnosing it until pretty severe disease. That's your classic, really furry, older horse, but that is severe PPID. And now with the recognition of the disease and the testing we have, we're able to diagnose it much earlier, which is great, which means that though we need to start screening horses and recognizing the earlier signs of PPID, so we can diagnose it early so that they don't have to retire, so that they don't have to, develop all the side effects that we can see from PPID that's more severe. So if your horse is 16 and he otherwise has no other issues, like PPID would not stop me from recommending you to keep riding and doing all the same things that you've been doing. The key really is that management is treatment of PPID is essential. You have to treat horses with PPID, and it is lifelong treatment. So that is something that it's not, if you just look at it day to day, it's not that expensive. But if you think about that's, a horse that may be halfway through its life, it does add up over time. But you have lots of time to plan for that because it's going to be a lifelong treatment. But it's still much better to invest in that daily medication than it is to not treat PPID, and then you have a horse that develops laminitis or reoccurring foot abscesses or immunosuppression and all the other side effects we see of PPID that's not managed. So I think that's really important to think about. And then knowing how to recognize signs, because it is true that PPID is progressive. So as horses age with PPID, it can be that their medication needs to be adjusted or increased over time. So recognizing and reassessment to say whether the treatment level that they're on right now is appropriate or whether they need to be increased is also important. So talking to your vet about like what are the early indicators that maybe we need to go up on our dose so the horse is not shedding out as well again in the spring, or you're having a hard time with keeping weight on. So having those types of things in your mind as well will be important over time. But otherwise, yeah, keep using your horse.
I was just going to say, if you're using your horse, there's a study out with the horses with PPID that were more likely to have hind limb suspensory desmitis. It came out of Connecticut in like big dressage horses. So treating the horse and keeping it in work, I think, is super important. And I just did a quick little Google search. So it's like $2.25 a day to treat your horse. So it's like a baby Starbucks a day, and your horse deserves it. So I think it is good.
Dr. Yardley, Morgan in Colorado wants to know how to manage a senior horse with declining joint health. What should she expect to spend on joint care each year?
Well, that's a hard question to answer because I'm not what joints she's kind of concerned about with the horse. So I think some of the things can be like if you're going to keep your horse in active work and your horse was, previously had joint injections performed, those are not going to magically go away as a horse gets older, and they might be potentially a little more common. So if you used to get your horse's hocks injected once a year, maybe twice a year now is going to be more in the realm of kind of a joint injection for the horse. So those would be kind of the things that I would think about. I would say, again, I'm glad a pharmaceutical company is not sponsoring us, but I think your joint supplements for these horses, it's too late. Like if your horse is old already, I don't think the nutraceuticals are going to probably work anyways for this, but like I always talk about, like it's way too late. Like if the joint supplements in theory are going to work at all, it's going to be when they're young. So doing that right now is probably not going to be that helpful. So putting the horse on, kind of a healthy NSAID. So we usually use Equiox on the horse as one of our most represcribed drugs in our senior horse population. So it's just a nice anti-inflammatory, and it really does help these horses stay in work.
Dr. Bianco, Sandy in California asked if mules and donkeys have different needs from horses in their senior years. How should she manage them as they get older?
Yeah, that's a great question. Mules and donkeys are challenging, but I don't know how much it changes as they get older because they're challenging when they're younger too. I think the biggest thing about mules and donkeys is that they're much more stoic, and it can be harder to identify disease in mules and donkeys as early as it is in horses. Just because their personalities are different. They're not, often as dramatic, and it can be harder to assess them as well. So, we do see donkeys and mules that go off feed or they're colicky, but they don't present to us until later in the course of the disease, just because they don't necessarily show it the same way or show pain the same way as horses. And so I think that can be a challenge. And then physically, they're just most of the time there, especially with donkeys, they're smaller when we're limited sometimes in our assessment. Doing a rectal exam, for example, in a donkey gets pretty challenging. Tubing a donkey gets pretty challenging. So I think most of the things are the same, except for the same as they age. So if you're used to donkeys, they're going to be challenging even when they're young. The other thing is that what I always like to say is that we have a big problem with obesity, especially in donkeys in this country. And so addressing that when they're younger is really important, because as they get older, they develop the same types of arthritis and other complications where it gets harder to get them moving and get weight off of them. So addressing their weight and keeping them lean younger will really help those donkeys as they age as well. So that's my plug there for not having fat donkeys.
Dr. Yardley, Chris in Arizona says his senior horse drops his hay and therefore wastes a lot. How can he reduce this waste?
So I think two ways. One, I would try to figure out why your horse is doing this. Like, if your horse doesn't have any teeth left in its mouth because they're all kind of expired because the horse is really old, then feeding hay is not going to be very efficient for the horse anyways, because they can't grind them up, and it's probably dropping. It depends on if he's dropping quid, if he's quitting. So like big long stems of hay looks like chewing tobacco that the horse is dropping out of its mouth. In that case, you'd want to switch the horse to, I usually recommend like an alfalfa or a Timothy based pellet that you can soak really well and kind of put the horse more on a mash kind of complete or mash feed of its hay. That way it's getting all its fiber that the horse needs. It would be kind of a really good way to do that. So that I basically would probably stop feeding the hay if the horse is dropping it all the time or quitting, because it doesn't have the dental arcades anymore to grind the feed up, and switch to a pelleted base hay feed.
Dr. Bianco, Donna in Missouri says her senior horses came out of winter thinner than usual. How can she help them gain weight in a cost-effective way?
Yeah, I think this is something we deal with a lot here in Minnesota for sure, because we have pretty long cold winter. And so I think the biggest thing is figuring out and trying to prevent them from losing the weight over the winter and figuring out what it is, why they're losing weight over the winter. I think older horses, if we have issues with eating hay, making sure that all their calories don't need to come from hay, and adding in those complete feeds or something that's pelleted to make sure that they are getting enough calories. And then thinking about like what are they doing differently in the winter? Here when we have negative 20 Fahrenheit days for 2 weeks in a row, like we had this winter, I noticed that my horses at home were eating twice as much hay as when it wasn't that cold, because it took that much. They burn so many calories just staying warm, and having that fact that I could feed them more and addressing that and feeding them more meant that my horses in my own house got what they needed and didn't come. And so that is really important, that feeding enough, recognizing that it is really cold, that they are going to burn more calories just trying to stay warm. Adding in, if your horses if you need a blanket during certain times of the year, or when you have cold spells, blanketing can be controversial, but if they are having trouble gaining weight, thinking about strategic use of blanketing. But also, if you're already at the point where they have lost weight and you're trying to put it back on, again, addressing the diet of, there are a lot of great diets out there that have higher fat content. So sometimes horses won't eat more. You give them more and they won't eat more because they're just maxed out. So trying to think of a more calorie dense feed. Oftentimes that's through a fat supplement. I don't mean supplement. I mean like feeds with higher fat concentrations, and some feed companies that make like a more fat supplement that you can top dress your complete feed with. But thinking about that as well, and kind of figuring out like, how do I help prevent them from losing that condition, but then, what the needs are to helping them put it back on.
Dr. Yardley, Wanda in West Virginia has two senior mares that have been living together for over 20 years. She wants to know what the best thing to do is if one passes before the other.
So it's great that she's already thinking about this ahead of time. Um, I think they're probably pretty bonded at this point, so it could be a difficult thing if one passes before the other. I guess I would say like some people will get like another horse, a miniature horse, or a small pony, or even a goat to have a companion, because horses are herd animals. So they do really like to be in a herd. So maybe kind of planning for that kind of ahead of time, kind of like the transition pony. That way they kind of have something else to kind of bond to in the field with them. I think one of the things I have seen though, when like a mate dies before the other one does, is I do like if I'm euthanizing the horse on the farm, I do let the mate kind of smell and kind of come up to the horse that I just put down. And maybe this is just, weird things I've kind of picked up or kind of snake oil, but I do think that they kind of like recognize that their friend is no longer there. And I do think they calm down a lot more. Like usually when you're putting a horse down, all the other horses come to the fence to see what's going on because it's different. I don't know what they're sensing, but I do think, that I don't have any evidence of this, but I do think that they like to kind of like smell their friend and know they're no longer there. And I do think that kind of cuts way down on the calling to their friend type of behavior. So that is what I have my clients do: bring the horse up, let them kind of sniff the other horse that has passed, and then I feel like a lot of times they kind of deal with it pretty well. So it's probably like humans, going to a wake, kind of doing a ceremonial kind of goodbye to the person. So.
Dr. Bianco, April in California wants to know how to manage a horse with fecal water syndrome.
If only I knew. So fecal water syndrome is, I'm guessing the question asker knows, but we're talking about here a condition where horses pass like fibrous fecal material, but also like a lot of extra water around it or like juice. And I think the first thing is to just make sure that you've talked to your veterinarian and ruled out other things that could be affecting the horse's feces, like things that cause diarrhea, colitis, or parasites, or just that we've addressed all the things. Sand are some other things that can affect the consistency of the feces. But if your veterinarian has diagnosed it with fecal water syndrome, that can be really challenging. I recommend really what we can do there is sometimes doing some trial and error with different diets, and making sure, again, one other thing is make sure you've addressed the teeth, if you haven't heard us say that enough yet, but making sure that that's not part of the problem. But little trial and error with diet. I've had these horses where the only thing that really helps is for them to be on a complete feed, because that naturally is going to be a more digestible. And I feel like I've seen, it's hard to get fecal water syndrome when you're on a complete feed, but that's a pretty drastic change in diet and can be a pretty big expense. So I think a little bit of trial and error is sometimes what is, once you've ruled out all the other potential medical causes, that it comes down to some trial and error, unfortunately.
I'm glad you got that question because we don't really have we're doing a study here at Ohio State right now, trying a drug on it, and it's not working. So, it's hard. It's a very hard disease to manage.
But I would say most horses with fecal water syndrome, it's more just it's just inconvenient. It's gross and it's hard in the winter, but it's, those horses usually are perfectly fine otherwise. It's just messy. And so I understand not wanting to have it, but at least if you kind of ruled out the medical causes, we don't see any like detrimental effects on the horse besides the, mess of it all.
Dr. Yardley, Cindy in our live audience asked if it's safe for a senior horse to be on firocoxib indefinitely.
So the manufacturer has only tested the drug out to 14 days. And that's all the data that has been published. But I will say anecdotally that a lot of these horses stay on this drug for a very long period of time with very little side effects. And we'd consult with your veterinarian, and I think doing some of these horses, we'll do like routine blood work on them just to make sure everything is still working, kidneys, liver, once a year, just to like you would for yourself or for your dog if it was on chronic NSAID administration. So I think veterinarians are allowed to use drugs off label, and this drug does get used off label a lot. And I think you just get it is a chronic NSAID, but of all the ones out there, it is the safest, I would say.
Yeah, and I'll just add that I definitely have seen horses with complications from long-term. That's where they'd funnel to is, the hospital and internal medicine. So it's a very low number compared to the number of horses out there on chronic NSAIDs. But I agree that, the ones I've seen have developed colitis, but that can be detected early if we're measuring, regular protein levels and doing that annual blood work to catch it. And it's one of those things where it is certainly safer than other NSAIDs. And I would much rather a horse be comfortable in its old age and, have that small risk of a side effect than to be so afraid of the NSAID that horse is in chronic pain, because that is for sure going to happen without the drug. And the side effects are, not necessarily going to happen in every horse and are pretty rare.
Dr. Yardley, Janice in North Carolina wants to know how to keep a navicular horse comfortable on a budget.
I guess depends on what they've been doing previously, but I think of a lot of these horses with, navicular syndrome, I find that shoeing changes are probably the best ways to kind of manage these horses. And in some of the studies where they, trial drugs and shoeing changes, 50% of the horses responded with just shoeing changes alone. So I think finding a really good farrier that is able to manage these, and then I think spending a little money up front. So if you find a good farrier, a lot of times what we do is we'll actually go out to the farm with the farrier, take some x-rays, and just make sure the foot is balanced and there's no other issues going on within the foot. And that really helps the farrier kind of trim the foot to what the horse needs and also kind of what is being shown on the radiograph. So that would be kind of one of my suggestions for these horses. Again, the Equioxac we had just talked about is a pretty cost-effective anti-inflammatory to kind of manage some of these horses.
Dr. Bianco, Judy in New York says her horse does not eat as much and loses weight when on Pergolide. What can she do to combat this?
I think we hear this not uncommonly, that horses, they have GI side effects or changes in appetite when starting Pergolide. And so people they want to stop giving the medication. But I would just emphasize again that PPID requires treatment with Pergolide. And, it's all the side effects that can happen with untreated PPID are so much worse than some of the GI things we see when we start Pergolide. So I think things that have worked for people are having a really gradual introduction to the medication. So starting off with a low dose and really gradually bring that up to what we want the horse to be at will help in some cases. That's really kind of I think most cases that helps. Dr. Yardley probably has plenty of experience with this as well in the field. Since I'm not I'm not the primary care veterinarian for most horses, so I'll let him have his say there as well.
Yeah, we usually start them on half a pill for at least 6 days to get them over the hump. And there are a couple horses in our practice that have to kind of stay on the half dose, and I do monitor their ACTH levels, and it's not as effective as the whole dose, but it's better than nothing at all. I've had a couple clients stop the medication altogether, and that's never gone well for that horse because it reverts back to its previous PPID state. So I think just kind of gradually increasing the medication is kind of the best way to do it, honestly.
Dr. Yardley, Paul in New Jersey wants to know how to maintain his horse's hoof health into his later years.
Yes, I don't really see a whole lot of hoof differences in our young to older horses. For as long as we're on a really good balanced nutritional diet, their feet are going to kind of pretty much grow at the kind of same rate they normally do. Talking to a bunch of farriers, like there is some seasonal variation in foot growth depending on the nutrition that we see. But I think overall, I think just having a good farrier and getting routine trims or shoeing is going to be what's going to be ideal for their feet. If you're talking about laminitis, that's a whole other story, but just normal kind of hoof health would be just continuing what you've been doing. As long as a horse has a good foot, I would just kind of keep going with that.
Dr. Bianco, Jan in New York asked if senior horses have any unique trailering needs. Do owners need to travel differently with senior horses than they would with younger animals?
I think this is a good question to be thinking about because I think sometimes we don't realize how much work it is to stand on a trailer, a moving trailer, and like exercise. You know, we see horses that come off and they look like they've just run to the clinic because it was whatever trailer ride they have was a lot of work for them to stand there. So I think as we've been talking about, older horses more likely to have osteoarthritis or joint pain. And so standing for long periods of time can definitely be harder. So thinking more about what kind of breaks you're taking, how long you're driving before giving them a chance to rest and just stand still for a little bit. That is something helpful. It's going to be helpful to all horses. All horses benefit from breaks during trailering, but I think having shorter periods of driving maybe would be ideal for a senior horse. The other things I've noticed in senior horses, they just seem to be a little bit more sensitive to changes in their environment. I think this is true for as we age as people as well, that we just get a little less tolerant of change in my routine, you know, change in diet or drinking water, the way the water tastes. So anything you can do to try to ease the transition in the environment. So if that means bringing some more of your own feed so you can have a gradual transition, or even your own water, because we do see a lot of impactions in older horses from not drinking enough. And so I think training your horses to drink, you know, flavored water so that when you go somewhere new that they recognize the taste of the water. Those kinds of things, they're just a little bit more sensitive, I think, to those changes. And so those would be the things I'd think about when trailering older horses.
Dr. Yardley, I think we have one more question for tonight. So this one's from Ophelia in British Columbia, who would like to know how to manage a horse with DSLD long-term to keep him comfortable.
So I think the biggest things for these is the DSLD is a chronic degeneration of the suspensory ligament. So a lot of these horses will do fairly well with I've seen some of them with very little management, but again, NSAID administration and shoeing would be helpful. So different kinds of shoes to help the horse get more support of its heels. You can put a suspensory shoe on. So those are kind of which actually has more kind of toe to it, so they don't sink as far into the ground. So those would be the kind of things I think about. There's a lot of adjunct therapies out there that might or might not be helpful with these horses, but I think that was kind of the biggest thing. And what I usually tell clients is at one point the fetlock's going to drop so low that its pastern is going to kind of interfere with this cannon bone, and in those horses will be painful. So maybe taking some baseline x-rays just to see how far it's dropped, because the angle is so far off in the fetlock that you're going to start seeing arthritis in different areas with these horses. So that is more what I kind of worry about. I think the suspensory can be painful. And unfortunately, we don't really have a good way to treat these except for kind of managing the pain. Like I said, NSAID shoeing recommendations would kind of be what I would do with these horses.
That's all the time we have for tonight. Thank you, Dr. Yardley and Dr. Bianco, for joining me.
Thank you for having us. I really appreciate being able to help take care of the old horse.
Yes, I have a passion for geriatrics, so I think this is a great topic to be discussing.
And thank you to Care Credit for sponsoring this event. Finally, thank you to our audience for listening and sending in these questions. If you're listening to us after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.